So thanks again for coming. Our sole purpose here is to communicate transparently, effectively, openly, together with the media so that we can message responsible messages in the community, making sure we're doing all we can to effectively address the COVID-19 crisis in which we are in the midst today. I want to start with just acknowledging the work that our public officials are doing. They're making a lot of courageous decisions that in some ways don't feel popular and dramatically impact the business community, but are necessary and will help to allow us to care for the patients that are affected by COVID-19. The hope is to, and we've all heard this, to flatten the curve, and so it is really important to underscore the vital responsibility each citizen has in our county to stay home as much as possible. And so again, a call out to our leaders in state, county, and local government. We have, as a team at Stormont Vail, come together in remarkable ways. It's created an environment that has been challenging and but has brought our team closer, and we are all very highly motivated to support each other and support the community. I do want to call out one opportunity that I think our state leadership missed, and as we try to contemplate digging out of this crisis, as we contemplate recovery from this, as we contemplate the delivery model of medicine at the end of this crisis, it would be a great benefit to be able to rely upon Medicaid expansion, rely upon access to medical insurance coverage for all of our citizenry. And so I hope that there'll be a time when the legislature can come back and step into that void that exists currently. We continue to limit our elective surgeries and elective procedural medicine. This is also in support of the need to keep people home as much as possible when it's not emergent or urgent. So that has a profound impact on our business model, a profound impact on the health system's financial model, but it is the responsible thing to do. And we will also be encouraging patients that have routine or non-emergent office visits to consider rescheduling those during this time that we need to stay at home. Many have asked about some of the more technical issues of what we have in the way of equipment and ability to take care of patients as far as hospital rooms, so we'll just provide that information here. We have now 47 negative pressure rooms available. We brought 16 additional rooms online this week, actually starting today. The last of those 16 are available. So that will bring to a total of 47, and we are considering adding an additional 16 as well. Not made that decision just yet. The one very nice component of the 16 that we added is that they're on a wing that has virtual nursing as a capacity. So this will allow fewer ingress, egress from rooms where positive COVID-19 patients are housed. We have currently 42 ventilators available for use. We have 234 med-surg beds and 42 intensive care unit beds available. As I think you're aware, we stood up a drive-through testing capacity at 920 Southwest Washburn. Patients continue to need to be screened before they arrive there. There is that call before you go number. So call ahead of time. That's 785-354-6000. We screened over 200 patients. We have screened over 200 patients thus far through that process. We are very intensely working on standing up a telemedicine capacity, both through phone visits and hopefully soon through video visits, so that patients can be serviced at home for their urgent and routine needs as well. This, we've been assisted by our primary commercial payers in a shift of way they will reimburse those visits. It'll be really important, I believe, that that capacity be expanded and will become more of a routine fixture in our delivery model as we emerge from this crisis. So we're in the process of trying to stand that up in a very robust fashion. We've done rheumatology, family medicine, internal medicine, and dermatology visits through telemedicine, or will be doing those soon. Excuse me. We'll be setting up an acute respiratory clinic. This will be at our North Fielding office at 4505 Northwest Fielding Road. This clinic will be established to screen and care for patients that are exhibiting respiratory symptoms suggestive of the possibility for COVID-19. We'll be taking these patients out of the clinics where we might ordinarily see these patients and shifting them to the 4505 Northwest Fielding office, so that we can cohort those and deal with them in the most efficient and safe manner. That clinic too, to acquire service at that clinic, patients will need to call ahead. So call before you go, and want to stress that number again over and over again, because that process allows us to prepare and to be safe for our staff and for our patients. We've now limited the public entrances to the hospital to the main entrance and the emergency department. The South Tower entrance is now for employees only. And on our website, we have added a pre-screening tool for COVID-19. The tool walks through travel questions and contacts and symptoms questions, and should help patients and others walk through the possibility of having contracted COVID-19. So that's up on our website. So with that, I think I'm done, and we'll take questions.
You mentioned virtual nurses. What all can they do that would keep those actual nurses out of the rooms?
So very often there's exchange of information, asking patient how they're doing, any new symptoms, a pain scale. Some of those types of questions can be asked. We are going to try to assist the physician's interaction virtually also, so physician can interact with the patient without having to go into the room.
When you're testing for COVID-19,
yes,
do those results go to the state health department, or do they go to a private lab? Kind of what's that?
So that's a good question. We are in the process of standing up testing outside of the state lab. So we have two commercial labs that we're working through, LabCorp and Quest. And then we also are in the process of standing up an internal testing capability. We are hoping to have that up and running next week sometime. Can't give you a firm date. And You're all aware of the issues around testing, the shortage of many of the reagents and the test kits and all that. That's getting better. We anticipate it getting better, but we're not quite there yet.
And because everybody's going to potentially the same people to get these results
Right.
back, is there a worry of backlog at these facilities to do
So
testing?
the test results from the commercial companies will come back to us, and then we'll give those results to patients. So I don't anticipate that'll be an issue. It'll be the same fashion that we deliver test results to patients currently. We'll of course be reporting a positive. We're reporting all of them to our state agencies and local agencies. You know, I don't think we've had issues with results, the communication of results. We've had issues with the length of time a test is taken, but that recently has gotten better, I think.
Still in that like 24 to
Yeah, it's usually usually 2 to 4 days
Okay.
is what we're experiencing.
With the internal testing, will you still adhere to KDHE's restricted guidelines on who can be tested?
No.
No.
The guidelines will be much more liberal, and we'll be able to test a great deal more. That's not very articulate. We'll be testing a large number of patients outside of the guidelines that KDHE has established.
And what do you expect that capacity to be?
Well, that's a good question. I can get that number for you. Don't have it.
Do you think that's been a problem, their guidelines?
No, I think they've been acting responsibly. They've only had a limited number of tests, and they were applying it where the best use of those limited tests were. So I don't think it's been a big issue, but I think KDHE has been managing the resources appropriately.
The governor issued an executive order, allowing the Board of Healing Arts and such to issue license
Yes.
under these circumstances. Can you help me understand how, can that help a hospital like yours, and in what way?
That's a good question. We are not anticipating a shortage of physicians. Things could change. They have changed in areas where the pandemic has hit the hardest. So in Italy, perhaps in New York, don't know, perhaps in Seattle, I don't know their experience, but where providers are exposed to the virus, then you lose, as they get sick, you lose their capacity to care for patients. So I can see a time, and that time would be if we experience the worst of what is possible, then we may need physicians from other states. We may need physicians that are licensed to do telemedicine in other states. All those things are possible. I don't think that those things are likely for our experience in Topeka and at Stormont Vail.
And I'm sure you've seen, even in the moderate projections
Yes.
of what could happen in our area, the Topeka region, Kansas City region, et cetera, will run out of hospital beds. And so I'm wondering, the steps that you've taken with scaling back, non-emergency care, and the changes that you're making to your building and such, to what extent do you expect that's going to handle the potential capacity, or are you looking at other alternative sites?
We have not yet looked at alternative sites. We believe that we will be able to handle what's coming within the Stormont Vail Hospital, but I think if we are, well, I'm going to come back. What's vitally important right now is this stay at home, that it works, that people adhere to the guidelines, and that through that stay at home process, we're able to limit the severity of the and the volume of the patients that we'll have to deal with. So If we end up on the severe end of that curve, we won't be able to handle in Topeka. We'll be faced with a situation as those in Italy and as those in New York are preparing to face. I think that's unlikely here for a host of reasons, but and I believe that in the kind of less severe and moderately severe, we will be able to flex up to handle it here.
But the social distancing is important to keep it at that
It is vitally important. This is our one opportunity to dampen the effect of this pandemic.
And are you soliciting any donations from the public or companies of any sort of, PPE, anything like that?
We are not soliciting donations primarily. Well, first of all, there's a great groundswell of people wanting to support, wanting to give, wanting to have a part in managing this pandemic. Some of what has been offered don't meet the criteria to be protective. And so as long as we have materials that support the protection guidelines, we're going to use them. And right now we feel that we're managing that every single day and watching it very closely, and we still feel we're in a good spot. That could change, and the guidelines change. You've seen them change as situations change, but right now we're not soliciting.
As far as the first positive test
Yeah.
Here at Stormont Vail, we know that the man is from Woodson County. Is that kind of a sign that rural areas are going to depend on Topeka and Stormont Vail to kind of take those patients in and care for them?
So I think it's a reality that our rural hospitals are going to have a very difficult time caring for these patients. We are going to try to help support them and so that they can deliver as much care as possible. But it is we have had a history and a very close relationship with hospitals in our region. We have historically taken care of patients that they can't, and that will be our position in this.
For the doctors and nurses that were interacting with this patient and doing the test results,
Yep.
and caring for him, are they having to go in isolation or quarantine? Kind of what are the protocols around?
This particular patient could not have gone better, so there was the suspicion, and so that patient was transported from Woodson County to Stormont Vail, and EMS handled it perfectly. Our team was alerted. Everybody was wearing the proper gear. He was moved right into an intensive care unit. It had all the features that we needed, and from the very beginning, it was handled beautifully. Everybody did the professional the professional activity required to keep everybody safe. So we're really pleased about how that happened. There likely will be times where people will have to be taken out of action because of exposure. It did not occur this time.
And as more people come from outside the county, should people in Shawnee County be worried at all about the virus spreading here if that continues?
No. You mean as in this patient?
Yeah, like as people come and be referred to Stormont Vail.
No, I think not, because those referrals will come again with this person under investigation or the suspicion of COVID-19. So the EMS transports are all geared up to do it appropriately, and we're geared up to receive them appropriately. So it should not cause an issue.
Obviously, without violating HIPAA, of
Yes.
course. Can you tell us how this patient is being treated? I think people are curious to know, what does that look like? What does the treatment process look like? And then is he going to recover, as far as you know?
Yeah, so the patient's in his mid-50s. He's male. He is currently in an intensive care unit and is critically ill. That's what I can reveal.
Going back to the personal protective equipment, there's kind of, and we mentioned, of course, people kind of sewing their own masks and stuff like that. What PPE is actually going to protect against this sort of virus and protect the healthcare workers?
So, so there are gowns, masks, excuse me, gowns, masks, shields, something we call PAPRs. So all of them are designed. The PAPR is actually a little bit of over-caution. Is designed for airborne protection. The virus is spread by droplets and not an airborne. And each of those are made to specifications to protect from droplets, from penetration.
There's been numerous reports saying that there's like new symptoms surrounding COVID-19. Some people that have tested positive saying they've lost their sense of smell, sense of taste. Are there new symptoms being added?
I've seen those reports. I think the understanding of this disease is developing. So again, I've seen those reports. That's all I'm willing to comment. I don't know if any people have listed those as officially as symptoms. I think they will be. I think they are. It seems to be pretty common to see that referenced as a part of the symptom complex.
And going off that, you've spent years in the medical field. Really, what do you think about all of this? Have you ever seen anything like what we're going through right now? What's going through
So it's completely unprecedented, completely uncharted water, completely uncharted waters. I can say that. So completely unprecedented. We're in completely uncharted waters, and both with respect to the pandemic and with respect to the economic disruption in both cases.
Going through, med school, stuff like that, how do they prepare you for a pandemic, a situation like this, or do they?
I don't recall any preparation for this in med school. There were obviously we were educated on epidemiological principles and so the epidemiology of the spread of a pandemic and all of that. But as to specifically dealing with this kind of an issue, no specific preparation in med school. Yeah.
I know you mentioned Medicaid expansion. Now, it's not obviously enrolled yet, but
Right.
What can people be doing right now that would be needing that aren't having that?
So really I mentioned it in the context of as we contemplate how we're going to recover as a state, as a county, how we're going to recover as a health system. Again, we're experiencing unprecedented disruption in our economics, unprecedented disruption, significant disruption in our normal financial situation. The federal government is going to step into that, but and we're going to manage this crisis responsibly and do the best for our patients and for our community. What I'm speaking to is as we begin to try to contemplate what the new normal looks like, how we're going to climb back out of this and reestablish our financial model. It would be very advantageous to be able to rely upon the idea that we have Medicaid expansion, and it would support the care that we provide to people without financial resources. We do that already, but it would be very advantageous to be able to rely upon that as we do our projections and our planning.
Can you explain for people that don't know, kind of like a dumbed-down version of what a negative pressure room is?
Yeah. So a negative pressure room, envision a room and with an airflow, a fan that takes the air out of the room and brings new air in. So that means the flow is negative, it's going out. And so what that accomplishes is a change in the air so many times per hour. And so that air is exhausted into the outside air, and new air brought into the room. That's the concept of a negative flow.
And theoretically
Mhm.
speaking, I mean, if it were to get to worst case scenario like Italy,
Yeah.
how many patients could rely on Stormont Vail? I mean, there has to be a capacity. You know,
Yeah.
it's like that is what they're
Yeah.
dealing with. It, I mean, it, again, is unprecedented for everybody.
It is. So the context was if it gets to be like Italy, then look to Italy. It's really not a pleasant view. So we'll do what we have to in that event, and I don't think that event's happening. But what we're doing as a community, what we're doing as a county, what we're doing across other counties in the state, this social isolation is vitally important to keep us from getting there. So I don't know what it looks like. It doesn't. It's a very dire picture. We don't want to get there.
And then my final question, how are your nurses and doctors doing, your staff?
Yeah. So I think everybody is very highly motivated to do their part. We have a very cohesive team, and we have all the same worries, all the same anxieties that everybody else does as well. So we have a drastically changed model of delivering care, and we have many people that were very, very busy one week, and the next week have very little to do, and it generates a lot of fear and anxiety and uncertainty about the status of their job and the status of their own health, and so we all are in this with those same worries and anxieties across the country, I think, and certainly across our region here. Yeah.
The president mentioned Easter as a possible, we can get back to business and things like that. Do you think that's realistic?
So it's not my, so any comment I make isn't directed at the president's comment. I think the steps that our county and our state and our local officials have taken reflect the reality that we face, and that it is vitally important that we adhere to this 30-day period of social isolation, so that I'm going to say that again. It's vitally important we adhere to this 30-day period of stay at home, stay safer at home, however you want to say that, so that this wave, this tsunami does not overtake us, that it's a wave that we can deal with. That's what we're here to support.
Can you talk a little bit more about the clinic up north that you're using as things kind of get worse?
So there's the North Fielding office, and so patients should call. We're going to screen patients in our normal clinics, our usual clinics, and then if they have acute respiratory symptoms, if they have symptoms that could be COVID-like, we're going to direct them to the North Fielding office, where they can be cohorted, where we can, where our staff can be prepared and protected to deal with that group of patients.
Have they had any patients come in there yet?
We haven't. I think it's going to open tomorrow.
Okay.
So yeah.
And we noticed the tent outside. Is it?
That's in preparation. Yeah.
Okay. Is it our tests and treatment going to take place outside? Or?
I don't think so.
Okay.
I'm not sure. The truth is, I'm not sure what that tent's for, but it's to get ready. But
that other clinic isn't for like testing, correct? It's just another.
So this will be a I'm sure they will do testing there.
But that's not the testing.
That's not the testing. That's for a respiratory clinic. Yeah. Okay. Thank you, guys. Thanks for the work you're doing. It's really important to keep people informed, so I appreciate it.